Hi, thank you for coming to this informal discussion on mindfulness and hearing my talk today on Practice What You Preach, mindfulness sessions for employees to promote the Whole Health Initiative. We know mindfulness is a new topic, it's a hot topic. According to the National Health Survey, in 2012, over 18 million people used mindfulness in their day-to-day routine. And this is just mindfulness and meditation. It didn't even include yoga and chiropractic, which are very common these days. Mindfulness awareness is paying attention in a particular way, on purpose, in the moment, and non-judgmentally. Non-judgmentally, I know that's a funny statement, but that says we should just take more adult time outs and relax. There's no right or wrong way to do it during our day-to-day. We just need to learn to breathe and take in the day-to-day for what it is. Mindfulness is being touted for its benefits within the research these days. It's positively related to vitality, life satisfaction, and interpersonal relationship quality. And it's negatively related to depression, anxiety, and stress. Doesn't that sound good? It's almost too good to be true, huh? Healthcare providers within the VHA are being encouraged to incorporate complementary and alternative medicine approaches into their traditional practices, an effort to treat the whole patient, mind, body, and soul. We propose that providing an opportunity for employees to experience a weekly mindfulness session will enhance the VHA's whole health program and will have a positive impact not only on the patients, but on the employees themselves. So as we mentioned, the whole health program. This is the rebranding and refacing of the VA. And they're putting at the center of it this mindful awareness. We know that within the mindfulness has been studied within the military community. And there's been studies that show that mindfulness addresses issues within the VA population, such as pain, depression. It helps improve sobriety. So they put it here at the middle, a very important piece. Mindfulness is a core component of the whole health program, which is being initiated within the VHA to promote a more balanced approach to healthcare and wellness. So you can see from this little diagram here. So that's what we're talking about today, mindfulness, and that it's going to be coming. It's going to be a part of our approach to healthcare. So it's time for us all to get on board. We need to practice what we preach. The use of complementary and alternative practices amongst healthcare providers is important because it integrates a holistic approach, creating an environment receptive to cultural and organizational change. So we can help promote this change within the VA when we practice it ourselves. We practice what we preach. A study on complementary practices for employees found that providers seem to be more accepting of complementary and alternative techniques if they had personally experienced these interventions themselves, and that participants who had actually used CAM or had a family member who used CAM were more likely to promote the practice themselves. So in order to understand CAM, it is best that the provider have a personal connection or at least have utilized these techniques themselves. By bridging together the promotion of CAM practices amongst our patients, along with applying the techniques in the workplace setting, this creates a dual approach to support the whole health initiative. And it is proposed that staff will be better suited to not only promote the whole health approach, placing themselves in a position to promote the program, but they will also benefit from the wellness technique themselves. So we've talked about this, so we're going to take a little moment to practice. So I want everybody to take a big breath in, relax, and this is how quick and simple we can incorporate this into our day-to-day. This is just going to be 30 seconds of a mindfulness technique. So listen to the prompts, and everybody going to relax.
And exhale. Close your eyes. Inhale again. Exhale. 30 seconds of mindfulness right here, right now.
Now, do we all feel more relaxed? An adult timeout. Just taking a few seconds to to take those big breaths and think about what we're doing in our everyday. So getting started, how do we get this started here at the VA? We propose that it would be beneficial to start this weekly mindfulness practice in our local clinic. It has been shown that allowing mindfulness technique in the workplace permits people to view events more objectively and dispassionately, and enables them to regulate their thoughts, emotions, and their physiological reactions more effectively. Can you imagine a workplace where employees are more balanced, they're more objective, and less argumentative? I think we all can. We propose that this 15 to 30 minutes weekly mindfulness session offered to employees to be done during the lunch hour would provide this opportunity for employees to experience this mindfulness technique. In the meantime, while we're getting this started, we can start working, incorporating this into our practice every day. And here I provided you 2 examples of how every day that we can bring mindfulness into our day-to-day. We can think about the ABCs of mindfulness. A is awareness, just constantly being aware of our surrounding, what we're thinking and what we're doing. B, just being, taking a moment to just be and experience what we're doing instead of just being on autopilot every day. Avoiding the tendency to respond on autopilot. And feed problems by creating your own story. Take a step back and look what's really happening. And C is for seeing things and responding more wisely, just making better choices. And the program that I like, that I've actually been implementing in my own day-to-day lately, it's called the 3x3 program, where when we're in stressful situation or we just need that adult time out like we've already talked about, we do a 3x3. You look in the environment and identify 3 things that you see, 3 random objects. Identify it, name it in your mind, take a deep breath, and follow that through with each of those objects. And by the time you get through that process, you tend to be a little more relaxed and a little more focused, and that's what we're asking. And you can see how being a little more focused would be beneficial for our patients, because we can be more involved, more interactive, and responsive to their needs. So, conclusion. Thing I want to hone in and remember, on purpose, in the present moment, and non-judgmentally. We feel that disseminating the key promotions of the whole health initiative would be more successful if key stakeholders, which is what we are, employees, providers, nurses, technicians, the ones who are taking care of the patients, can understand the benefits of complementary and alternative medicine techniques. That the provider, the technician, the nurse, those who are taking care of the patients, they sit in prime positions to promote the use of mindfulness techniques, and is perhaps the most important stakeholder with regards to promoting these techniques to patients. By having the opportunity to practice complementary and alternative techniques such as mindfulness, we are set in a position to intimately understand the practice, using it in our daily routine, and be more focused and attentive. The VHA is incorporating. That's already started. This is the new wave. We got to get on the boat and move forward with this. So we should start to practice this ourselves. And it only makes sense to practice it for the staff. Give the staff an opportunity to practice. Therefore, if we engage employees as key stakeholders and provide an opportunity for staff to participate in mindfulness sessions, we are breaking down barriers and to successfully providing a holistic-based healthcare approach. Mindfulness has been utilized in many Fortune 500 organizations with beneficial outcomes, and is currently being promoted as the core component of the whole health initiative. So by providing the opportunity for the staff to actively participate, the organization is practicing what they preach and creating a platform for success for promoting the whole health initiative. So I hope that you have got an understanding about the use of mindfulness in our everyday and can see the benefits of this, and can get on board with promoting and practicing this in our everyday, and get on board with the whole health initiative. Thank you.